And welcome back, everyone. Those are our cartoons for today. I hope you guys enjoyed them. Every day it's something different. Sometimes funny, sometimes I don't know if you do enjoy them. But anyway, in the studio with us today, of course, we have a plastic surgeon who is Dr. محمد الناصر. And he is going to be talking to us about a very serious subject, which is acne in children and teenagers, rather. So, Dr. محمد الناصر, thank you very much for joining us on the program this morning. Welcome.
First, Dr. Muhammad, I want to ask you about acne and what could be the reasons behind this. Some people, you would find it really severe, and others would be envied for having a very smooth skin. So what could be the reasons behind just having acne for the first time?
Actually, you're quite right. Acne, it comes from the Latin word acme, which means points. If you look at the skin, it actually points, whether it's on the surface of the skin or underneath the skin.
Yeah.
And there is no age limit for acne. It can usually start from infantile age up to the age of 50.
Infants, like 3 and 4 or 5?
Yeah, 3-month-old, you can find acne on them. So you have to understand the pathology behind acne in order to treat. So the pathology actually relies on the sebaceous cyst or the fat glands in the dermis. So you have the fat glands and you have the ducts. So sometimes you have increased production of sebum or the fatty material inside in the skin, and sometimes you have the obstruction. So if you have more fat that cannot be excreted on the surface of the skin, that will lead to more obstruction, more inflammation. So your treatment will be targeting reduction of the fatty material, or you're gonna treat the inflammation, okay, or you try to work on both mechanisms.
Yeah.
No, you go ahead.
What about eating? Eating things, can it cause us for acne, or it's in our genes, but there are some types of food that would help it appear?
Actually, the causes of acne is quite multifactorial. You have a genetic cause, you have environmental cause, you have causes related to immunology and food. So it's quite multifactorial kind of pathology.
Definitely, doctor. And so, doctor, what can you say for teenagers who do have a serious case of acne? I'm not talking about a mild case of acne now. I'm talking about quite a serious case, and it's been going on for, say, longer than 6 months, longer than a year, and it's carrying on. What can they do?
First of all, they have to see a physician. A physician that's interested in treating acne patients. So acne, you may have an acute manifestation of acne, that's the comedone, which is the blackheads or whiteheads.
Yeah.
Or you may have pustules, cysts, or you may have long-term sequelae of acne in terms of scars. But if you have an acute exacerbation of acne, you have to see a physician in order to prescribe a specific medication that may target, as I told you, the mechanism of pathogenesis of acne, reduction of the fatty material in the dermis, or the reduction of the inflammation. And the most widely prescribed medication is the Roaccutane. So they have to see a physician in order for them to get treated well.
Also, there is, I don't know if it's a myth or not, correct me if I'm wrong, that it's something that has relation with age. So as you get older, it's going to disappear from its own. Is this right or wrong?
It's usually, there is a tendency by the age of 30 for acne to diminish.
So we're still having 15 years, Camille.
Yeah, but you still have like 10% of the population that will continue to have acne in their 40s or in their 50s.
Really?
Yeah.
Yes.
So it's not a matter of age and it's going to disappear. If you have this problem, you should
seek medical advice.
Yeah.
And also for the advice for teenager, you shouldn't squeeze those papules. You shouldn't play with it.
Absolutely
You shouldn't
not.
scratch it. Because as I told you, with the like if you have to look at the skin, you have the sweat gland, the fat gland or sebaceous cyst, and the ducts. If you're gonna scratch it, you're gonna introduce bacterium
And infect it,
and get
which
infected.
will lead to scarring.
Yeah, so it will be a vicious cycle. So it will be an endless cycle.
Yep.
So you have to avoid like scratching these papules. You have to seek medical therapy. You have to look for a good cleansing agent in the morning and in the evening in order to clear up the pores on the skin.
That was what I was going to ask you, Doctor, about cleansing agents and all these things. They have so many different ones on the market. They promise you, I mean, I'm not going to name any name brands, but they have so many different ones, and they promise all these different things, from facial washes to creams and on-the-spot gels and all these different things. And of course, you see on TV, you see perfect skinned people, whether it's a man or a woman with beautiful complexion, and they might show one pimple, which is probably not real,
Of course.
and then they put on the magic cream, and then it disappears. And you know, all these teenagers who, of course, right now probably don't have huge self-esteems. They're watching these shows and they're thinking, well, if I buy this lotion, this will work. It's going to clear up my skin.
Actually, you're quite right, because the main impact on teenagers is not the manifestation on the skin. It's actually the manifestation on the psychological manifestation.
The look, how do I look?
Yeah, and it will be reflected badly on their psychology.
True.
They'll be anxious, depressed, especially if acne is manifested on the face, because you are facing everybody with your face. But like, if acne can be found on the neck, on the back, on the
sometimes,
chest.
yeah.
But if it's on the neck and the back, you will not pay a lot of attention for it, because you
True.
can cover it with the cloth. But if it's on your face, it will really affect you socially. And you can find some teenagers are actually withdrawn from the community because of that. So that's why you have to seek early medical treatment in order to get it really settled.
And cleansing, actually, Dr. Muhammad, what are the steps? If you can give us an advice about this. If I wake up in the morning, what shall I do with my face? If I'm going to put some makeup, how can I clean my face after this? Yeah, personal question, yes.
That's fine. Regarding the cleansing agent, you can like choose the cleansing agent that usually prescribed by a physician. You don't get like over-the-counter medication or cleansing agent. That's the first thing.
Peeling, for example,
Yeah,
peeling.
you can use peeling to clear up the pores, okay? But you mentioned a very important point, which is makeup. You have to be very attentive to the type of the makeup you put on your face, because some
They
makeup...
use oil-free makeup?
Yeah, it has to be first oil-free, because the pathology is actually oil or fat. So if you put like a makeup made up of oils, you'll make your situation worse. Because
And
these pores
you have
won't-
acne and you are going to put makeup with oil in, it's going to be worse.
Yeah, so you have to really ask your doctor about the type of if you're the makeup you're using. The other thing regarding the sunblock or sun cream, because after you're cleaning your skin, putting makeup, you're heading to work or to school, you're putting sunblock, which is very important. We all know that you are seeking like a sunblock with an SPF more than 30. SPF stands for sun protecting factor.
Yeah.
But it has to be for non-oily skin. You know, there is no point of choosing like a sunblock from the pharmacy, any sunblock. No, it has to be for non-oily skin.
Non-oily
Yeah,
skin.
because if you're gonna use a sunblock, which has a lot of oils in it, so you're gonna make the situation worse.
So again, we are talking upon the situation of having acne, what to use. Yeah, is that right?
And also
so if you have acne, not use anything with oil.
During the day, you have to be attentive to the type of food you're eating, because everybody knows which food makes him like, or he has allergy towards any specific kind of food, like chocolate, like fatty meals or something. So you have to avoid it if you
True.
can.
Not only for acne, but it could be really very bad for health.
Yeah, but with the talking about what oily skin, obviously, because of the sebaceous glands and the sebum, that does lead to the oils coming out. So you avoid oily makeup and oily stuff, of course, when you can. But I've also noticed that you can have acne and you can also have dry skin. Is this true? You can have combination skin with the oily skin. And then what do you do if you have the oily skin, but you also need to use something because you have dry areas?
You're right. You have to use moisturizers.
Yeah.
You know, and you have to pay attention to the type of medication you're using, because like as I explained to you earlier, like you have like the comedones or the blackheads and whitehead. What does it mean? So it's actually you have to look in this pathology in three-dimensional kind of analysis, like anything else like in the world. You have to observe, you have to analyze based on your information to get to the right decision and the action. So in the dermis or in the skin, you have 3 layers. You have probably all people, lay people think that skin is 1 layer. It's actually no, it's actually 3 layers. So the superficial area or the layer is called the epidermis, and a deeper layer is called the dermis, and then you have the subcutaneous tissue or the fatty layer. You have to know if you're going to use these materials on these papules or comedones. So you have the fat gland or the sebum glands, and you have the ducts, which lies in the dermis. So if you get obstruction, so the obstruction is underneath the skin. So all what you see is the iceberg. So you have a big pathology underneath the skin.
The problem is not what you see.
Yeah, so if you have the blackheads or the whiteheads, so what does it mean, a blackhead or whitehead? A blackhead means that you have like a part of the skin that has oil in it, and it has already opened up. And this black thing is the keratin on the top of the skin. While the white thing, it hasn't opened yet.
Yeah.
So you understand me? So you'll get dryness also from Roaccutane, or I mentioned this medication, which leads to dryness of these points or these papules because it's filled with fat. So if you use it on an excessive dose for a longer period of time, it will lead to more dryness. You can ask patients who are using Roaccutane, they get like dryness of their mucous membrane, of their eyes. So you have to be really attentive to the dosage of the medication, and also the creams and the products you put on your face in order to get the best equilibrium.
Treating acne, could it be done by laser?
It can be done by laser. Actually, the treatment...
For teenagers as well?
Yeah. For laser, if you're going to touch on laser, there's like medical therapy, there's laser, there's surgical therapy. If you're going to define what's laser, laser stands for the word...
light beams?
Yeah, light, or lumière amplifiée par émission simultanée de radiation. So you have like a light, and you have the radiation on the other spectrum. So that this light gets magnified. So it's the heat, it's the thermal heat, which leads to like remodeling of the collagen, which leads to production of new collagen. And collagen is actually the protein.
Doesn't it actually mean by actually burning it?
Yeah, after it's burned the skin, it will lead to more remodeling of the collagen, which is actually the protein of the skin. So if it burns it, it leads to, like if you have a land or something and you are planting some kind of rice or other, sometimes you find farmers are really burning this kind of land in order to get...
Which is not good for the environment,
Yeah,
but when it comes to laser...
But if you treat it like that, it won't come back, doctor?
It depends. Like laser, you have different kind of laser. You have fractional laser, you have non-fractional laser, you have ablative for resurfacing, you have coagulative. You are using different energies, you are using different width of the... So it depends actually on the pathology of the patient. If the patient has scars, it may help. I did a recent study that I published, presented in the American Society of Cosmetic Surgery, that the combination of laser and steroid injection in the scars, because like in acne patients, usually called the ice marks or ice pits, and it's alternating therapy of laser and steroid injection in these scars that left with acne patient, and it usually leads to marked improvement in these scars.
Injections, chemical injections?
Yeah, steroid injections. Because steroid is actually an anti-inflammatory medication.
Yeah.
You know, so it would decrease the progression of the scar, because scar is actually like you would heal by scar whether you get treated or not.
True.
But excessive scarring means excessive inflammation. So you want to counteract the effect of inflammation.
Yes.
You got that?
Doctor, the other thing is, apart from laser treatment and that sort of thing, when is it possible for a teenager to seek prescription drugs for acne, say like Roaccutane, which I know is a very strong drug?
Actually...
and I'm sure there must be other drugs on the market,
yeah,
new ones.
It's right away. Because like if they will lift with the scarring, as we just discussed, laser and surgical treatment, it will be long-lasting marks on the skin. So you have to really take care of these things early on the course of treatment. So you have to see a physician who will take your weight, he will weigh you, and you have to get the correct dose of this medication in order to avoid side effects. Because like Roaccutane can affect the liver, so you have to get a routine checkup of liver function test or LFT.
If you have acne?
Yeah. Because
wow.
like the dosage of Roaccutane has to suit your weight. So the other thing, it's usually contraindicated in pregnancy. So if you are pregnant, you shouldn't get Roaccutane. So you should get a pregnancy test. So that's why you cannot go to a pharmacist with all respect and you get an over-counter kind of medication.
I was just mentioning this yesterday.
You cannot do that. You know,
yes.
you have to see a physician, you know, and or anti-aging specialist who will really see you, and he will see what kind of complexion you have, what kind of skin type. We have 6 skin types, you know, what kind of pores you have, you know. You will get your medical history, and you will get the best treatment that suits you.
Is it going to be expensive, this best treatment?
No. If you're going to weigh the cost, it's not going to be.
It's not.
No.
I want to ask about the creams and lotions that are used to deal with this problem, the acne problem. Sometimes they contain cortisone, and we know that the excessive use of it, or even if you're not using cortisone excessively, it's not good for the health of the body. These creams are going to heal these acne, and they are going to have side effects on the body because of the cortisone?
It's probably it would target something in the pathology. Probably if you go to the area, my explanation that I presented for on acne, you have the fatty glands, which is really secrete a lot of fat. You have the inflammation. You have the obstruction of ducts. Okay, so steroid will counteract the inflammation. So if you have an inflammation, so it will treat this inflammation.
And if you're pregnant, do not put these creams that contain cortisone.
Yeah, you have to avoid actually cortisone, because cortisone is really like a chemical which leads to more salt and water retention. You know, and as you know, like pregnant women, they have already this capability of collecting water because of the hormonal effect of pregnancy.
Yes.
So it will lead to more weight and salt.
So if you're having acne and you're pregnant, wait a little bit. It's not going to be...
It's not to wait, but you have to go to a physician to prescribe like a specific medication that suits you. For example, like you have like the bacteria, you have also an infection like related to acne also.
Yeah. And this should be treated immediately.
You get like tetracycline or doxycycline, for example. But these medications are contraindicated in pregnancy. So you can get another kind of antibiotic. You got my point?
I prefer for pregnant ladies, and this is my own point of view, with all my respect for yours, of course, doctor, that if they can avoid medications as much as they can, do it. Avoid any medications. That's what I recommend, actually, because you don't. If anything bad happens to you, it's fine. But if it's for your baby, you are going to blame yourself for the rest of your life. So that's why. You have a question for doctor?
Well, I was just going to say, so is there any other things that we could possibly do to avoid acne, or is it something, as you said before, if you've got it, it's going to be genetic, etc., etc.?
Actually, you cannot really avoid it. You cannot really prevent it. You cannot really prevent it, but you can act on reducing its manifestations and consequences.
And then what I was also going to just say to you quickly was, and if you do find that you have it, basically what you're saying to us, doctor, is the best thing to do, or your child, your teenager has got it, the best thing to do is just to take them to a physician as soon as possible and see what can be done before it gets worse. Because
like as I told you, the medication, it's usually it's a course of treatment, lasts few months. So after the treatment finished, they get like an exacerbation or recurrence or relapse of their acne. So you have to see your physician again, you know, because like probably you may get like 2 cycles of treatment and you will be good for a good time.
Yeah. Dr. Muhammad Al-Nasser, the plastic surgeon, thanks a lot for being here with us and for your information as well. Thanks a lot. Thank you. We are going to stop with a short break and we'll be back with more segments of Good Morning KSA. Stay tuned.
Welcome back, everyone. And thanks for joining us. And I hope you guys enjoyed our doctor on the program before, who was, of course, telling us all about acne and acne in teenagers and how to avoid that. And Marwa, talking about that, what did you think about the doctor and his comments, some of his comments about just teenage acne?
Well, Dr. Muhammad seemed to be really informative for me, but what I believe in, Camille, that being away from the sun as much as you can is going to help you a lot, and using some protection for your children as well. It's very important, especially if when they go to school, because it would affect them a lot through the whole year while they are exposed to the sun. And the sun these days is so dangerous. It's not like before. So I guess that the sunblock is really mandatory for children as well if they go to school. So try put this in your minds. I'm talking to moms. Really, they should be putting this in their mind.